Hello, 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 YouTube world. It's Miss Patty with For Your CNA here for our weekly live question and answer session where we answer all of your questions on CNA training, testing, and workplace. And those of you that are here, hello. I see a couple of you guys have already checked in. Hi. When you guys come in, just send me a little wave or a thumbs up or something in the chat. That way I know you're here. And we got started just a smidge early today, which is very unusual for me. I'm usually late to everything. My family jokingly calls it Patty Standard Time because I'm always late for everything. So coming in a little early today is I'm turning over a new leaf. So for those of you who don't know how this works, if you type your questions in the chat, I will answer as many as I can in the time that we have together. And while I'm waiting for everybody to come in, I always give a little mini lesson, something interesting to talk about that might be of value for you. And today, I had something else scheduled to talk about today, but I got a phone call about an hour ago from somebody, and this is a topic that comes up over and over and over and over, and I know I've talked about it in the past, but it's been a little while, so I think it probably is a good idea to talk about this again, and it's about the pay rate for CNAs. So everybody, is very excited that the hourly rate for CNAs is going up. And I absolutely agree with that. I mean, that's fantastic news. And it's well-deserved and, too late in coming, right? So it should have happened a long, long time ago. But we can all agree that, getting paid more is a good idea. But the question was, to me, so how much are CNAs making now? Now, this is somebody who went through training many years ago, 4 or 5 years ago, and did not enter the workforce as a CNA. But now she's in a different stage in life, so she's looking at getting certified as a CNA to be able to properly care for her family and have the financial means to advance. So her question was, how much are CNAs making now? I've heard the pay has increased, and it has. But this is a question that's really hard to answer because the answer is it depends. It depends on where you're working. So if you're working in a nursing home, they're going to pay different than a hospital. If you're working in mental health, they're going to pay different than a walk-in clinic. So where you work is going to affect your pay scale tremendously. And I'm going to get to that in just a second. But it also depends on what shift you're working because there's a shift differential. The shifts that they have the hardest time covering, they tend to pay more for. It also depends on the type of work that you're going to be doing. But a big part of the pay scale has nothing to do with any of that. It has to do with how hard it is for the employer to find employees. So you can have 2 nursing homes side by side. I mean, literally on the same street. And one of them may be offering $12 an hour. And the other one might be offering $16 an hour. Now, of course, you're thinking, I'm going to the $16 an hour place. Everybody would. I mean, that's just kind of natural, right? You want to get paid the most amount of money for your time, and that just makes sense. But have you ever stopped to think about why? 2 nursing homes side by side, why is one of them starting out at $12 an hour and the other starting out at $16? They're not doing it out of the kindness of their heart. I mean, you might think they are, but they're not. That is not what this is. They don't really care about you. I wish they did, but they don't. The reason that somebody is offering that much more is because they're having trouble finding qualified help and keeping it. So that's kind of the key phrase there, keeping it. Because a lot of people would apply for that $16 an hour job. It's intriguing. It's, sounds really good, especially if the guy right next door is paying a whole lot less. But you have to think about why. I mean, why are they paying that much? And usually it comes down to a couple of different things. The first is they're usually short staffed, which means that you're earning that $16 an hour. You have twice as many patients as you would have right next door. So short staffed places generally will pay more for help because they need it, right? It's become a critical need. So this is important. So when you're taking these higher dollar an hour jobs, you need to understand that you're going to be working higher than normal for the higher dollar amount. So that's number one. The second reason, so short staffed is going to play into this. The second reason is because of high turnover. Now, it costs a lot of money to hire people and train them. It does. I know that you probably don't see it from your standpoint, but from an employer standpoint, it costs a lot of money to hire and train and get somebody up and running. So high staff turnover is costing a facility a lot of money. And if they have high staff turnover, that means that they probably have gone through most of the CNAs in the community at one time or another. So they're having to offer more to entice people to come back. So short staffed, high turnover. And the third reason is probably poor management. So if you're working at a place that doesn't let you go home when your shift ends because nobody showed up to cover it, or doesn't allow you to take time off when you put in for it, or doesn't have your back when you lodge a complaint about an unsafe work environment or something like that, poor management will run off good staff in a heartbeat. So you've got three very good reasons that an employer would have to pay more to get staff on board. None of those are good news for you, okay? Now, we also have another situation right now that is affecting pay scales in a very big way. And this is actually kind of what I talked about probably about 2 months ago. And it's about travel CNAs. There's a lot of travel CNAs positions open, and this didn't used to be a thing, right? CNAs were not really a travel modality. It just, you'd have travel nurses, but CNAs not so much. Well, since the pandemic hit and everybody is now desperate for CNAs, high need areas are willing to pay as much as they have to pay to bring people in from the outside. So CNAs now have these awesome travel opportunities. And some of these travel opportunities, guys, are paying like $30 an hour. You know, I see them. I'm plugged into a whole bunch of CNA groups on my phone on Facebook. And, you know, I see these advertisements all the time for, you know, $25, $27, $30 an hour. And man, that looks really appealing. It really does. But again, you have to ask yourself, why? Why are they having to pay this much money? Now, part of it, I will be honest, part of it is because everybody's going to travel agencies because they can get paid a whole lot more, right? That makes sense. So now we have a very small CNA pool of people. We have a whole lot more positions open than we'll ever be able to fill. So these CNAs are just kind of traveling the circuit, getting as much money as they can in each facility. But there's a couple of problems with travel. Now, it can be a great opportunity. It can be a great money-making opportunity for sure. But there's a couple of problems with travel that we have to consider if we're going to take these opportunities, right? So one of the problems with travel CNA is obviously it's travel, right? You have to be away from home, which means that you're leaving your family. You've got to have somebody take care of your kids or your pets or that type of thing. Sometimes you can get a travel assignment in your community, and that's awesome. But for the most part, travel means away from home. Now, the second problem with travel is that the patients don't have a continuity of care. So when you are a travel CNA and you go into Iowa and you are in a nursing home in Iowa doing CNA skills, you don't know those patients. You have no idea. So you don't know if Margaret is normal or if this confusion is new. So things get missed because we don't have the same staff with the same patients all the time. Nobody really knows what normal is for these patients, and things get missed. And that's a real big problem in healthcare. Continuity of care is super important, especially at the CNA level, because the CNAs are the ones that pick up on a lot of these symptoms. Henry's not eating as well this week. That can clue the nurse into something going wrong. Or Miss Margaret's a little bit confused today, and that's not normal for her. Or I've noticed that Rodney is sleeping a whole lot more. That's not normal. Normally he goes to activities at 4. I can't seem to really wake him up except to go to dinner. That's not normal. Well, if you're not with these patients on a regular basis, you're not going to pick any of that up because you're going to think that, whatever they're doing is normal. So we miss a lot of stuff, okay, with these travel assignments. Because to be honest with you, nobody in the facility knows the patients. The nurses are all there for travel. The CNAs are all there for travel. Nobody knows the patients. And a lot of times their families just can't come and visit as often as they would like to. So who's there to know how the patients are changing? So continuity of care is a really big problem. So we've got this situation right now in healthcare that's very detrimental to patients, but it's also detrimental to facilities. Because when you have high turnover of staff or have frequent travelers come in, you don't have a good cohesive workforce. Let's face it, if you know that person working at the end of the hall is making more money than you are for the same job, you're automatically going to resent them, and you're probably not going to help them at all. And you know that they're leaving in 13 weeks, so why would you even get to know them? So you don't end up with a good cohesive workforce that's willing to help each other out. And then the reputation of the facility kind of goes down because it's not really a pleasant place to work, right? Nobody really wants to go to work there because nobody really cares about each other. There's no group dynamic. There's no coworker camaraderie. So that can be a real problem too for the facility. But it's also a problem for CNAs as well, because CNAs learn throughout their entire career. They learn from taking care of different patients. And by the way, if you're a CNA and you're not learning something, that means that you're not asking enough questions, you're not trying hard enough, you're not being observant. You should be learning something with every single one of your patients. And that's an important part of being a CNA. Your education does not end at graduation. It actually really just begins at graduation. So if you don't have a cohesive workforce, if you don't have a situation where you can ask questions, and you don't have management that is fostering a learning environment, then that is ultimately going to be a problem for you and your ability to grow as a CNA. So there's nothing really good about any of this situations other than the facility has a warm body in that position that they need for staffing ratios. That's really the only good part about it. And you get a little bit more money in your pocket. That's a good thing too. I don't gloss over that. I understand that. But it can be detrimental to the entire system. Now, let's think about that facility for a second, because those travel CNAs, if they're paying $25 an hour for a travel CNA, right, they're actually paying more than that to the agency that got that travel CNA, because there's an administrative fee on top of that. So nursing homes really cannot afford this travel situation. And if everybody's out traveling because of the money, there's nobody left to work locally. So it doesn't really matter, there's nobody there to work. So there's just not enough CNAs to go around. And this brings me right back to, you better be recruiting. We can't get out of this mess unless you're actively recruiting other people, telling them how wonderful it is to be a CNA. So let's go back to the original question. How much are CNAs making? Well, the answer is as much as it takes to fill that position. Every facility is going to have a different number there. If you have a facility that doesn't have a good reputation, they're going to have to put a bigger number to get people in the door. If you have a facility that has a great reputation and the staff all like each other and works really well together, they don't have to put as high of a number on that position because people will want to work there if it's a well-managed team. So the answer to that question is, how much are CNAs getting paid? It depends on the facility. How much do they need to pay to get someone in the door? And if the number is high, remember, you're going to be earning that. It's not free money. So the higher the number, the more work you're going to be doing, or the crappier environment you're going to be doing it in. You have to consider that. You've got to remember that when you're going into these places and you're responding to these ads. Now, there's some things that we can do to help this, right? We can make sure that we are performing very well so that maybe at the end of our travel contract, if we took one, they hire us on. We can, if we're doing a really good job, then the employers may be willing to pay us a little bit more, not as much as travel, but a little bit more to keep us in that position because they do like us. But we need to be aware of the pitfalls here in judging just on the amount of money that you're going to get paid. You also have to think a little bit about the perks as well. If you're in a position that has good benefits, they're not going to pay you as well because you get the benefits to help offset that. If you're working in a situation where you're getting no benefits at all, no paid time off, no sick time, no 401k, nothing like that, they're probably going to pay you a little bit more because they don't have to, offset the cost of the benefits. You have to take that into consideration as well. You also want to look at the opportunity for advancement. And this can play a huge role in your decision on where you want to work. So there's a lot to go into it besides just how much am I making in this position. You want to look at the whole package. How many patients am I going to be responsible for? Am I going to be able to leave at the end of my shift because you're fully staffed? Is management responsive to my needs as well? There's a lot to look at when you're evaluating an opportunity like that. So I just wanted to spend a few minutes and talk to you about this because this keeps coming up over and over and over and over and over. And it's kind of dangerous to judge a facility just on the dollar signs that they're flashing. Because remember, at the back end of that dollar sign is what they expect for that money. And that's what you really have to get to. Now, I have employers call me all the time. In fact, yesterday I just had a doctor's office call me right here in my hometown who's looking for staff members and was begging me to send them some of my students because they're so desperate for employees. So you have to, kind of look outside the box too. There are a lot of opportunities out there as a CNA that may not be the traditional hospital, nursing home, rehab track. So look in your community for additional opportunities that, might pay pretty good that, maybe aren't traditional. Okay. So let's see who's here. Hello, Jessica. Hello, Alexis. Hi, Joan. Hi, Den. Let's see here. Hi, Najoey. I'm not sure how to say that. Hi, Francesca. Kathy Ann. Hi. Ketley. Hi. Let's see. Sharon. Thanisha. Yardley. Hi, Tina. Hi, Pierre. Abiodun. Lindsay. Hi, Jennifer. You've been on vacation. Oh, I can't wait to hear all about it. I hope that it was wonderful. Let's see here. And all right, so let me get to some questions. Pierre says, nice to watch the live chat today. I'm so glad that you were able to make it. Let's see. Tina says, CNAs worked at the COVID test sites during the pandemic. Yes, there is more demand for CNAs. Yes, Tina, that is absolutely correct. In fact, we had our local health department contact us, and they hired like half of my class when COVID first started. I mean, just half of them. They're like, we'll take them. So yes, there are opportunities there as well. Lindsay says, we just found out that Prometric have put testing on hold here in Massachusetts, and Headmaster is taking over there. Is there much difference between the two? We trained our students for Prometric. Oh, Lindsay, that is a great, anytime you have a changeover in the middle of training, it is super stressful. So Headmaster's a little different than Prometric. So Prometric, everything is uniform. So testing is exactly the same in Florida and Texas and New York and Delaware. Everyone that uses Prometric, it's exactly the same test. Same scenarios, same care plans, same checklist, same everything. And that's what makes it really easy for me to teach Prometric, because everything is uniform. Headmaster does not do that. Headmaster is uniform in some ways, but a lot of their scenarios are going to differ based on the state requirements. So some states will test on skill XYZ, other states won't. So Headmaster is a little bit more specific to the states. What I would suggest is that once Headmaster takes over, you're going to have access to the Headmaster dashboard. Now, you can actually look at this from some of the other states that use Headmaster. If you go to my website, foryourcna.com, about 3/4 of the way down on the page, the front page, you'll see a map. When you go to that map, there's little pins in the map, and if you click on it, it'll tell you who the testing agency is. And I think Headmaster has, I don't know, 9 or 10 states. I don't know the number. I unfortunately don't remember how many states. There's a new testing agency in town. I'll talk to you about that in a minute. But you can click on the Headmaster ones and look at the candidate handbook for those states, and it'll give you a pretty good sense of how they grade the test, how the test administration is. So I would probably, if it were me, I would look at some of Headmaster's candidate handbooks, kind of compare, and then when they get the website set up for Massachusetts, go in. I think you said Massachusetts. Go in to your dashboard, look at the candidate handbook, because it really spells out all of the requirements, and then cross-reference with what you've learned. Then you want to get that information to your students so they can make the accommodations they're going to need to make. Some Headmaster states require the use of side rails during skills. Prometric does not. So that's going to be a big change if your test administration requires that. Other states require that you actually check the bed to make sure it's locked. Prometric does not. So, there's going to be little things like that you may have to incorporate. But there shouldn't be a whole lot of accommodations there. But I would look at the clinical skills checklist. Let's see here. Kathy Ann says, no benefits. Yeah. Oh, one thing real quick about, testing agencies. When, because I told you guys a couple months ago that I hired a virtual assistant. I was super excited. Still am. She is awesome, by the way. Yay, I mean, she has saved me tons of time, but she's actually the one that updated that for me. The map with all of the testing agencies. So we just updated it. It's up-to-date information. But while she was doing that, she noticed that there was a brand new testing agency that I knew nothing about. And it was called Credentia. And I really, was kind of like, how did this one slip by me? And not only did it slip by me, it has 17 states. So it is the biggest testing agency now. So where did this come from? So Credentia, just a little fun fact for you that I found out. Credentia is actually a kind of an offshoot of the National Nurse Aid Assessment Program, which is part of the National Council of the State Boards of Nursing. And they actually bought the CNA testing arm of Pearson and created Credentia. So Credentia is a very well organized, well thought out CNA testing agency, and they're making huge waves in the CNA testing market. So it's going to be interesting to see. Now, those of you who have been with me for a long time, you know that my big mission in life, is to help standardize CNA training and testing throughout the United States. That's really what I'm all about. That's why I do everything that I do, is because I want CNAs to be trained and tested the same way everywhere so that you can effectively work from state to state. And you don't have this situation where, I learned it a different way, and it can just be really, really confusing. Well, that's the way you did it there. This is the way we do it here. And there was no standardization. So my big goal is to help standardize. Well, with Credentia now taking the point on this actually might happen. And it might happen in my lifetime. So I am like super over the moon excited to see where Credentia is going to take us as we move forward. Now, in the meantime, I'm researching their standards to figure out where they differ from what we teach. And the next videos that I create, I will actually have a Credentia version of those. I'll have Prometric and I'll have Credentia version so that we can make sure that the videos that we're producing are aligned with whichever testing agency you're going to be using. So keep your eyes open for that. Those will be out sometime, I'm hoping at the beginning of the year, somewhere in the beginning of 2023. So it's a really, really big project for us. I mean, really big. So it's going to take me some time to get everything videotaped and edited and then uploaded. But we are hoping. So let's see here. Jennifer says, so what's the difference between EMT and CNA? In order to work in the ED where I live, you have to have your EMT and your CNA. Oh, that's a great question, Jennifer. Okay, so EMT, the term EMT is Emergency Medical Technician. CNA is Certified Nursing Assistant. So they're different, okay? Emergency means something is happening right now that needs immediate action. Now, remember the whole purpose of a CNA, right, is to follow the care plan. That's what we do. We're there to assist nurses with routine tasks on stable patients according to the care plan. That's our mission statement. Well, EMTs don't have a care plan because they're in the middle of an emergency. So there's no care plan. There's nothing that they can go to for direction. They have to operate a little bit more autonomously. So EMTs are trained to perform emergency care until they can get the patient to either stable or to somebody that has more training and more authority. So that's really what the EMT. So EMTs are going to be able to recognize emergency situations. They're going to have the ability to quickly respond to those emergency situations, and they're going to be able to help stabilize the patient in the absence of other more qualified individuals. Okay, so CNAs, we do more custodial type care. So in an ER, we don't really necessarily have a care plan to go by. You'll have nurses there, and the nurses can direct you. Care plans don't always have to be written. They can be verbal. You'll have the nurses there to direct you, but remember, CNAs cannot work autonomously. EMTs can. So this is where you, to a certain extent, let me caveat that, to a certain extent. So this is where you have in the ER situation, you're going to have both EMT, CNA hybrid, so they have both trainings, right, in one person, so that they carry out the tasks as assigned by the nurse. That's the CNA part. But they're also able to recognize emergency situations as they happen. That's the EMT part, and be able to stabilize the patient. So having these two different types of training in one person can be very beneficial in an ER setting. I hope that helps. Let's see here. Lindsay, thank you for asking. I was here waiting to ask. I'm one of the students who's confused by this development. Yeah, it can be very, very confusing for students that are getting ready to test. But go to Headmaster's site, look at some of the candidate handbooks and the clinical skills checklist, and kind of see where it differs from what you were taught. The research is out there. You're just going to have to put a little bit more work into it, because I haven't done that yet, but it's on my list. Jennifer went to Six Flags and Universal Studios. Oh, wow. Southern California. I've never been out to California. Never been. Going to the West Coast, it's definitely something that's on my to-do list. I'd love to make it out there. I really want to go see the giant redwoods. That's on my bucket list. I really would like to see that. But I'm glad you had a great time, Jennifer, and I'm glad you came back to see us. Let's see. Thanisha says, I just got approved. Now I'm waiting on my date. Oh, we're going to keep our fingers crossed. Good vibes out to you, Thanisha. Hi, Carmelane. Thanisha asks, when you're going to take the test, should I wear scrubs? Yeah, you should, because there's something to look the part, act the part. You don't have to. I mean, they're not going to fail you or kick you out if you're not in scrubs. But when you're in scrubs, you do tend to act a little bit more professional. So, yeah, you'll see people there testing in jeans, because scrubs aren't a requirement, but you really should. You really should. Lindsay says, I guess Headmaster is just assisting getting everyone testing. Prometric is still here also, just not accepting applicants. Yeah, well, something that you may not know is all testing agencies operate on a rolling schedule. So, like right now, today, they have candidates scheduled out for probably 3 to 5 weeks in the future, right? Because it's a rolling schedule. So they've got to get through all of those. Well, in the meantime, Headmaster is picking up applications, but they can't approve you for testing and test you tomorrow. There has to be a window of time where they can accept applications, send it to the Board of Nursing for approval. The Board of Nursing approves you, sends it back to Headmaster, and then Headmaster schedules your date. And they always have to give you at least, a week to 10 days from the time that you get your testing date until you're actually tested. There has to be a little bit of lead time there. So that's where that overlap is. So Prometric is still actively testing the people that they've already registered. That's going to take some time to work through. Headmaster is now picking up the applications, but it'll be a little bit of time before they actively start testing. There's usually a firm switchover date. I don't know what that is, but there's usually a firm switchover date, just to make sure that all reporting is accurate and comes through the right channels. Okay. Clotilde says, hi, Miss Patty. Hi. Carmelane says, I passed my test skills, but written I did not pass. I'm so sorry to hear that, Carmelane. I actually have an ebook that I created that will help you with the written test. In fact, I sent it last week. I talked about it, and Tina contacted me and asked me for a copy, and I sent a copy to her. She actually emailed me yesterday, I think it was, and sent me the results of her test. She got a perfect score on both the written and the skills. I mean, how amazing is that? But she said that the ebook that we wrote was a big help to her. So we are trying to get it up on the website. We're having a little bit of difficulty with how that's structured, how to deliver it. So if you send me an email at foryourcna@gmail.com. Just tell me that you want a copy of it and I'll send it out to you, okay? But that'll help you, Carmeline. And Kathy Ann. Kathy Ann asked, how do we pass the written test? Let's see here. Camilla, hi. Joan asks, is EMT the same as BLS? No. Okay, so let me explain this. There's a lot of acronyms here. So EMT is Emergency Medical Technician. That is the person. That's a title, like CNA, right? It's a person. BLS is Basic Life Support. BLS is CPR for healthcare professionals. So why do we get a different term, right? So CPR is CPR. Everybody, understands what CPR is. You use your hands, you push down on the chest hard and fast. We're circulating the blood until somebody with something else gets there and can maybe, possibly get the patient back with us. CPR does not make people better. All it does is circulate blood. That's all you're doing is circulating blood. If the patient's running out of oxygen, we need to put a little more oxygen in, so we'll give them a couple breaths. But most of what we're going to do is circulate blood. That's CPR. Anybody can do CPR. Anybody can take a CPR class. It's open to the public. In fact, everybody should know CPR because you're much more likely to have to do CPR on somebody you know versus at work. So everybody in the world should know how to do CPR. But that's CPR. CPR for healthcare providers, well, now we're doing CPR not to save a loved one or as a goodwill gesture in, the pickle aisle at Walmart. Now we're doing CPR as part of our job. So when you're doing CPR as part of your job, we need a little bit more education here. We need a little bit better knowledge of what we're doing. And we're going to have a few tools that we wouldn't have in the pickle aisle at Walmart. So we have to learn how to use those tools that we'll have at our disposal in a clinical setting. So CPR for healthcare providers, that's a whole mouthful, isn't it? That's a lot to say. You got CPR, which anybody can do. That's just what we call layperson or heart saver CPR, just anybody. And then you got CPR for healthcare providers, but man, that's a whole lot to say. So we're going to shorten it to Basic Life Support, or BLS. Okay, so BLS is CPR for healthcare providers. We're just calling it something a little bit different than CPR for healthcare providers. We're going to call it Basic Life Support. And then you've got ACLS, which is Advanced Cardiac Life Support, which is a whole different class, and that's usually given or taken by nurses or those that are or paramedics or those that are in more critical life-saving roles. Okay, so Basic Life Support, CPR for healthcare providers. ACLS is a step up, and those are the ones that are going to give the medications and do the treatments to hopefully bring the patient back on board. Okay. Alexis says CNAs where I work do darn near everything except pass meds. Yeah, that's probably true. Remember that personal care is not nursing care, though. Personal care is not nursing care. Personal care is bathing, dressing, grooming, feeding, toileting, socialization, things you do for yourself every day. That's personal care. That is not nursing care. You do not need to be a CNA to get dressed in the morning or to brush your teeth or brush your hair. Stuff you can do every day all by yourself. If you can't do it by yourself, somebody in your house is probably going to help you. Again, you do not need to be a CNA. Bathing, dressing, grooming, feeding, toileting, those are things that anybody can do without additional training. That is not nursing care. Nursing care are things that you don't necessarily do for yourself every day. Things like catheter care, oxygen, understanding signs and symptoms to watch for, knowing what is normal in the aging process, caring for different types of tubes, learning to dress around IVs, those types of things. Now that needs a little bit of additional training. So that's where that nursing component of CNA comes in. But bathing, dressing, grooming, toileting, feeding, all of that kind of stuff, yep, that's perfectly okay in any setting. Hi, Marie. Uh, Kathy Ann says, for Florida, do we need to watch only your skills or other skills? Kathy Ann, my skills are specific to Prometric, which is who Florida uses for testing. So my skills videos are exactly what you need for Prometric testing in Florida. Guys, everybody that's asking for a copy of the ebook, you're going to have to email me. Once I close this out, all of this goes away. So I'm not taking notes. So you need to send me an email. Go to my website, foryourcna.com. Click on contact us. Send me, just fill out the contact form and ask for the book, and I'll send it to you. Lindsay says Prometric is our main testing source as of 11/21. They haven't announced any turnover. It seems that Headmaster is just an option to get certified. Oh, that's interesting, Lindsay. That is interesting. There are a couple of states. I think there's 3 states that actually give a choice. I guess now there's 4. It looks like Massachusetts has joined that as well. Chibuzor says hi. Tina says, yes, yes, yes. I'm so blessed to have that ebook just a few hours before my exams. I'm very grateful. I'm so glad it helped you. Let's see here. The book explains in detail how to tackle the questions that worked for me. Awesome. Awesome. So guys, just go to my website, foryourcna.com, click on the contact us, fill out the form, ask for the ebook. We'll send it to you. Okay. They train the CNA class on personal care though. Yes. Yes, Jennifer, they do. Now, okay. So let me explain why. So, personal care is one of those things, you know how to do it on you. You should know how to do it on somebody else. But when you're doing it on you, you're not going to purposefully endanger yourself, right? Because you're doing the skills on you. So you're not going to overextend your arm when you're dressing, or you're not going to wipe the wrong way during pericare, that type of thing. But when you're doing it on somebody else, it's really, really easy to get mixed up and do things that you don't even realize you're doing, but are putting other people at risk. And that's why you're trained on performing those personal care skills on other people in CNA training. Yes, personal care is covered in CNA training, but it's important to understand that personal care is not nursing care. Now, when you're doing personal care, though, you should be observing for any abnormalities, anything that's weird, strange, unusual, doesn't look right, doesn't smell right, doesn't feel right. Anything that you notice needs to be reported to the nurse. Now, that is a nursing skill, okay? So observation and reporting is really what sets those CNAs apart from all other healthcare workers. So other healthcare workers do, CNAs do, and observe and report. Okay, so that's kind of the difference there. And Massachusetts and Florida have the same test. If you're testing with Prometric, yes. If you're testing with Prometric, yes. If you're testing with Headmaster, no. So you need to find out who you're testing with. So guys, this is the first I've heard of it. I haven't had any time to research this, so I don't know. But if your facility where you're going to school is the one that's choosing where you test, you need to find out from them what the testing parameters are. Okay, so who are they using for testing, and what are the parameters? Now, I don't know how they're splitting this up. How some, Headmaster is taking some and Prometric is taking others. I don't know. So I don't know whether it's based on the school. I don't know whether it's based on the individual. I don't know if it's based on geography, Eastern and Western or Northern and Southern. I don't know. So I really can't give you any defined direction on this because I haven't looked into it and I don't know. And I don't want to give you misleading information, okay? So I'm not sure. Hi, Gloria, good to see you back as well. Let's see here. Patty, do you have any practice tests on NHA PCT exams? No, I don't. And PCT is one of those really everything in medicine really seems to be very confusing right now with all of the different acronyms and the separation between who does what. There's a lot of overlap and nothing is really well defined. So I don't really know what's going to be covered on NHA's PCT exams. I know years and years ago, I did teach PCT and we did test through NHA. And those exams covered EKG and phlebotomy as well as CNA. So I don't know. It's been years since I've looked at that. I'm not an authority on it, so I'm probably not the best one to ask. I do know that NHA has study guides available on their website. You might want to look through those. Those will probably be your best source of information. All right, guys. I think that probably clears us up for today. We have a lot of people to congratulate. So for those of you who don't know, if you have tested and you pass a state exam, come back and let us know. Just drop me a message on any one of my videos because they all come to the same place. I'll see it. So drop me a comment on any one of my videos and let me know that you passed. Don't put it as a reply to somebody else, though. Make sure it's a fresh comment. That way it comes into my inbox. I don't always see the replies. So just drop me a note on any one of my videos. Let me know that you passed and we'd be happy to congratulate you. If you didn't pass, let us know and we'll see, what we can refer you to maybe help you on your next attempt, such as our ebook. And if you're getting ready to test, let us know that too, so we can send out super good vibes to you. So today we're actually going to send out good vibes to Female Deity and Jocelyn Treem, who are getting ready to test. So we're going to send them lots of luck, good vibes. They're going to do fantastic. Hopefully they're watching the videos and getting prepared for the test. Now, these are the people that took the test and passed, so we want to send a special congratulations to them. So Westlandia Noel, congratulations on passing the state exam. Daryl John, great job. XOXO Keisha Prescott, congratulations on passing the test. Annette Spriggs, welcome to healthcare. LaBelle JJ, congratulations, super great job. Tina got a perfect score in New York, so congratulations to you, Tina. We're super happy to be part of your journey. Thank you so much for allowing us to help you. And Eveline Felix. Now, Eveline, I got to tell you about this real quick. So I don't know if you guys know this, but our program, our book, and our online course is being used in schools all over the country. In fact, I just bought a really big map and map pins to put in all of the schools that use us all over the country. So that's going to be really neat. It'll be a nice project. And once I get it done, I'll show you because that might be fun for you guys to see where we're at. Well, one of our partner schools is a Mochiley Technical College down towards South Florida. And the instructor, Nancy, contacted me today and said that she had a student that went through our program and tested and passed, and she wanted to let us know because she was very proud of her student. So, Eveline Phoenix, we want to congratulate you on doing a great job in passing the CNA state exam. And Alexis let us know first thing as soon as she got on that they passed the state exam as well. So congratulations to all of you. Welcome to healthcare. We are super happy to have you in, inpatient care. We hope that you do a great job with the patients and find fulfillment and joy, and that you're able to bring other people in as well so that maybe we could get to the bottom of the shortage. We need all the CNAs we can get. So make sure you're recruiting. So thank you guys so much for joining us today. And remember that we are here every Thursday at 3 on our YouTube channel. The replays are always up as well after we go off of being live. So you can, watch the replays anytime you would like. And we've been doing this for over a year. And we love to have you guys join us next week as well. So Thursdays at 3 Eastern, same time, same channel. And if you hit the subscribe button, guys, and ring that little bell, it'll let you know when I go live. So one button and you're in. Super easy. Guys, I am so close to my YouTube silver play button. I've got to get 100,000 subscribers. We're at 91,000 and change. So if if you like what you hear, if you've watched my videos, I never really ask for likes, but I'd really like to get that. I think that would be super cool. So if you could help us out and hit the like button if you haven't already, we'd really appreciate it. All right, guys, until next week, I will see you. Until then, happy caregiving. Bye.